Our division, facial, plastic, and reconstructive surgery, it's actually a really broad spectrum of surgeries that we actually cover.
We focus just on the face, so we don't work anywhere else in the body.
If a cancer causes a patient to lose a part of their face, like the nose or the ear or eyelid, then myself and my partners will then go and do the reconstructive component. From a cosmetic standpoint, both Dr. Oyer and I have been very specialized trained.
We work on brows, lifting the brows, lifting the eyelids, reshaping the nose like a rhinoplasty.
We work oftentimes with or in conjunction with our rhinologist. If they have sinus issues, they see them, and then they'll come and see us for like nasal obstruction, or if they want changes to their appearance of their nose.
We do facelift, neck lift, and all those sorts of things to help rejuvenate the face, along with some in-clinic procedures like Botox or injectable fillers.
We constantly are re-educating ourselves, going to conferences, talking to other experts, and making sure that we really provide the best and most up-to-date care possible.